Members, good morning. It's the appointed time. I'll call the meeting to order. For today's meeting, there are 4 papers to be discussed. Prior to the meeting, the administration provided information paper ECI-2023-24 for members' perusal. It sets out the latest changes in directorate establishments approved since 2002 and the impacts created by such changes. Members, please be reminded that if you have any direct or indirect pecuniary interest in relation to the items to be discussed today, please disclose the nature of such interest in accordance with the Rule 83A of the Rules of Procedure before you speak on the item. Please also keep in mind Rule 84 of the Rules of Procedure regarding voting in case of direct pecuniary interest. Agenda Item 1. Proposed creation of 2 supernumerary posts of 1 administrative officer staff grade C in the Labor and Welfare Bureau for 5 years to pursue the policy portfolio of targeted poverty alleviation and provide policy support to the Restructured Commission on Poverty. And 1 Principal Economist in the Office of the Government Economist under the Financial Secretary's Office for 3 years, to supervise the work on review of methods for monitoring the poverty situation and analyses as well as researches for various welfare policies upon the restructuring of the Commission of Poverty with immediate effect. Upon the approval of the Finance Committee, this item is carried over from the Establishment Subcommittee meeting on the 22nd of March 2023. We have with us today Mr. Chris Sun, Secretary for Labor and Welfare, Mr. David Leung, Deputy Secretary for Labor and Welfare, as well as Mr. Desmond Howe, Acting Government Economist. We have a few members who have pressed the button to speak. Let's start with Mr. Lai Tong Kwok. According to the paper, the post for Principal Economist will be created for 3 years, but the alleviation of poverty will straddle across various different terms of government. Can the administration explain why the Principal Economist proposed will be able to finish his or her work regarding poverty alleviation within 3 years, and that the post will be created on a supernumerary basis? Thank you, Mr. Lai for the question. This is a good question. I'd like to explain the major principles why we proposed this creation. Our principle is to use the minimum time we have. We gauge the minimum time required. On poverty alleviation, we propose the creation of the post for 5 years, as it is a long-term policy work. But for OGE, we propose the creation of the post for just 3 years. For the first 3 years, the post holder will have to look at how we measure poverty, and we will require a lot of economists to provide advice to us. We are of the view that if we can sort out the theoretical issues, afterwards we may not need a principal economist anymore 3 years later. So that's why we decided on 3 years. Mr. Ho. Thank you, Mr. Lai, for the question. As mentioned by the Secretary, the Poverty on Commission will be 1 year long for the term after restructuring. We still have 1.5 years left after restructuring of the Commission on Poverty. We propose to create the post of Principal Economist for 3 years because we want to take forward the recommendations made by Commission as soon as possible. After the 3 years, if we think that we still need the post of Principal Economist, we will seek the advice from LegCo again. Second question. it is important for the current term government to take forward is poverty alleviation work because it has to do with the long-term welfare of the city or of the people of the city. Looking at the duties to be discharged by this D2 officer, it includes coordinating with other bureaus and governments to take forward the poverty alleviation work. I remember when you first proposed to create this post, well, last time you proposed a D4 post due to heavy workload. In my view, the D2 post that you propose, if the duties and responsibilities are similar to that of the D4 post that you proposed, well, why are you asking this D2 officer to take up such important tasks? Why are you so confident that this post holder would be able to bring his or her role into full play and that the work of poverty alleviation can be taken forward holistically? Thank you, Mr. Lai, for the question. The post holder of this D2 post will mainly focus on taking forward poverty alleviation work. This proposed D2 officer will take forward the work in a focused manner or dedicated manner. We have been handling this type of work for some time now. It's just that under the current framework, we think that we can take forward the work in a more focused manner and handle the theoretical issues. We want to save as much money as possible. We only propose the creation of this post when we find it absolutely necessary. Thank you. Next, Ms. Eunice Yong. Thank you, Madam Chair. I noticed that the LWB is proposing the creation of two posts that are the AO Staff Grade C and the Principal Economist posts. After the restructuring, I understand that you want to take forward targeted poverty alleviation work. In the existing framework, is there anyone who is taking forward poverty alleviation work? I see that according to paragraph 3 of your paper, there are other AO officers taking care of, say, child welfare and family welfare, etc. But you did not mention officers dedicated to poverty alleviation work. Well, the Commission on Poverty has been established for some time. It's just that it's been restructured now. How are you going to persuade us to create this new post? Well, Mr. Lai asked about the questions about 3 years. I think poverty alleviation is a long-term work to be taken forward. Would the administration consider to create a permanent post instead under the new structure? After the restructuring of the Commission on Poverty, how is this post holder, that is this AO officer, how is he or her going to lead the entire administration to take forward poverty alleviation work? I understand this is not just the responsibility of LWB. It falls under the portfolio of other government bureaus or departments as well. Housing is one part of poverty alleviation work as well. I see that the administration did other work to help alleviate poverty in the past. With the completion of light public housing, moving forward, what indicators are you going to set for poverty alleviation and how are you going to measure poverty? Secretary. Thank you, Ms. Yong. The chairman of Commission on Poverty is the chief secretary for administration. Before July last year, it falls also under the Chief Secretary for Administration's office. Now, after the restructuring, the CS is still responsible for the work of the Commission on Poverty, but now it falls under the portfolio of our bureau. It's just that we have decided to create the post of the AO officer to lead the poverty alleviation work. The major leader of poverty alleviation work is, of course, our Chief Secretary for Administration. As Ms. Yong mentioned, it involves housing, healthcare, etc. So it will involve the effort of various governments and bureaus. Under LWB, we have myself and Deputy Secretary and other colleagues to take forward poverty alleviation work. This proposed AO officer is going to coordinate the efforts of various government and bureaus, but we will not only rely on his or her own effort. Chief Secretary for Administration, as well as myself, will give our colleagues direction on how to take forward the work on poverty alleviation targeting children. Well, according to statistics, we noted that the issues have been significant. I understand that current resources have been put into liaising with Commission on Children. I see that this AO officer proposed will take forward poverty alleviation work, but how are you going to take care of cross-generational poverty problem and poverty alleviation of children? Under LWB, this proposed AO will chair the Commission on Children. There are duplications of responsibilities, but not entirely. As we tackle poverty alleviation, young people and children are groups that we attach importance to. We have Strive and Rise, and we target students from junior secondary schools to see how we can offer more support to them. I don't have any more questions. My questions have been asked by Mr. Lai and Ms. Yong. Next, Mr. Tony Che. Thank you, Madam Chair. Taking forward targeted poverty alleviation work is important. My impression is that in the past, as we try to offer help to the vulnerable people or the poor ones, the administration had put in a lot of resources. Various government departments and bureaus had done a lot of work on it as well. However, we are of the impression that the government hasn't done well enough to help people move up the social ladder. Well, Secretary, you are proposing these two posts at D2 level. Well, I give my support. I notice in paragraph 5 of the government's paper, the post holder will identify the poverty groups or those who fall under the definition of poverty. I understand that you will spend about 1 year, and also you will look into setting key performance indicators. With the time you have, Would that be enough for you to take forward the measures or relevant initiatives effectively? I'm concerned whether the resources from the administration can be devoted into the target groups. We have talked about cross-generational poverty and poverty of children. I hope that the relevant problems can be alleviated within a reasonable time frame. It is only that we can benefit the society. We have been offering support to the target groups in the areas of housing and healthcare, etc. Well, there are views that the government's policies are making the grassroots people lazy. I hope that the Secretary, you can review the creation of posts and see whether the D2 officer will be able to achieve the targets. If you are of the view after careful consideration that this is appropriate, then I'll give my support.
Thank you, Secretary. We believe that this proposed post is appropriate for what we are trying to achieve. The COP wishes to identify the target groups as soon as possible and to set up certain indicators. As we all know, in the past, when we define poverty, we are only using a single indicator, that is their income. And now, let's say we are concerned about people living in subdivided flats or single-parent families. There are actually many children living in single-parent families. We need to assist the children. Usually the single parent is the mother, and she is usually at an age where she is employable. How are we going to help her find employment? These are the things that we will be looking into. We want to do something concrete to help them. So in due course, when there are more concrete details, they will be discussed in the COP meetings. Mrs. Yip would know we will report the details by end of April. Thank you. Next, Dr. So Chun-Wing. Thank you, Chair. The key of targeted poverty alleviation is the formulation of policies and the follow-up and monitoring of the results. Today, for these two positions in the LWB and the Financial Secretary's office, they are exactly going to do these. So I support the creation of these two posts. In the paper, it is mentioned that the COP has been restructured. And there is mention that there will be formulation of KPIs. I would say that the restructuring is a sort of a revolution. I would like to know, regarding the KPIs, what are they going to be? Do you have a timetable for them? Second, I've been concerned about the Community Care Fund and the Social Innovation and Entrepreneurship Development Fund under the COP. These two funds actually helps a lot in terms of poverty alleviation. Compared with the Community Care Fund, the Social Innovation and Entrepreneurship Development Fund doesn't seem to surprise the public in terms of results and its effectiveness. Now, with the restructuring of the Commission on Poverty, would you consider enhancing the SIEDF? How can we effectively combine poverty alleviation and social development? This is how we can make poverty alleviation sustainable and effective in the long run. I hope that you can step up cooperation with different sectors. This can ensure better poverty alleviation results. Secretary, thank you, Dr. So, for your suggestions, and thank you for your support. First, on the formulation of KPIs. On the COP level, we would like to measure the effectiveness of poverty alleviation. After identifying target groups, we would like to know that after we have put in efforts, do their circumstances change? Like what I explained to Mr. Tony said earlier, I think that we should not just look at the income as the indicator of poverty. Let's take the elderly as an example. Most of them do not have income. So should we just look at their income to decide whether or not they live in poverty? There are some data that is available, but there are some new data that we would like to collect and analyze as well. So this is what the COP will be pushing ahead with. And under the COP, there are two funds. The first one, Community Care Fund. The second, Social Innovation and Entrepreneurship Development Fund, SIEDF. I understand that the public may not be as aware of the SIEDF as they are with CCF, because this is about collaboration with the industry. But I will certainly relate your views to the relevant departments to better utilize the SIEDF. Next, Mr. Chan Yong. Thank you, Chair. Thank you, Secretary. I have some follow-up questions on members' previous questions. Of course, we are very much concerned about poverty alleviation. As mentioned in the policy address, I understand that the workload is very high and additional manpower can ensure the best result. Just then, Dr. So mentioned KPIs. For targeted poverty alleviation, be it for the coming 3 or 5 years, it is important to set KPIs. But there are views of whether or not there can be any progress shown. Let's say after a few months, what can be achieved? And in the future, if we are already seeing results, then we'll be able to provide even more support. And for the directorate post, is it possible for the post holder to review into the consolidation of the various funds available? And if you can collect data on absolute poverty or relative poverty. For relative poverty, perhaps progress is not as significant, but for absolute poverty, I think we can see better results. These are my suggestions. I would like to see what you think. Thank you. Thank you, Mr. Chan, for your suggestions. After major KPIs are set, we will be announcing them at least once a year to LegCo. We want to report our progress and what targets have we achieved. As for the consolidation of various funds, if things can be consolidated, then of course we will try to do so. And As for absolute poverty and relative poverty, how are we going to measure the effectiveness of our poverty alleviation efforts? Hong Kong is such a developed society. So in poverty alleviation, it is not just poverty that we are trying to alleviate. We are trying to make people's lives easier. So for this term of the COP, we would like to identify how to best measure the effectiveness of poverty alleviation. In the past, we only measure the income, which is inadequate. Any follow-up, Mr. Chen? No? Then Mr. Yu Pat Leung. Thank you, Chair. I believe that the topic of poverty alleviation is a major concern of our whole society. And I believe that we need to ensure that at the top level, it is well taken care of. And I believe that the creation of these two posts can certainly contribute to the targeted poverty alleviation efforts. Just as the Secretary mentioned, that we are not just trying to alleviate poverty, but rather we are trying to make our people's lives better or easier. So we need to first target and identify target groups. In the past, the government seemed to have done a lot of poverty alleviation work, but somehow the situation has not improved, even with the vast amount of resources put in. For people who are receiving welfare, they may be aware of the poverty alleviation measure, but for the rest of society, they may not be well aware of these policies. So, of course, it is important to formulate policy of targeted poverty alleviation. But for item E, propose and follow up on promotion and publicity strategies and measures, I believe you should put in more thoughts on how to best go about this. You need to let the public know what kind of strategies or measures you are going to have to alleviate poverty. Mr. Yu, you are spot on. That is how we can step up promotion. In the past, the public may have the impression of us presenting simply data or theories, but they couldn't really see actual success stories. But in my exchange with the COP members, not just in our regular meetings, we had a few informal exchange sessions as well. We all agree that promotional and publicity work has to be stepped up. We don't want people to think that we are only having meetings and not doing anything concrete. We want to be able to tell people what we have achieved. So in the coming days, other than having meetings, we will be going into the community to let people know what we have done. And we, of course, would like to invite the COP to do the same as well, so that members of the public will be able to know what we actually did. Any follow-up? No. Thank you.
Next, Dr. Chow Meng Kong. Thank you, Madam Chair. Good morning, Secretary. A few members have raised their questions, and I agreed with what they said. I agree that we have to tackle poverty, but the effectiveness has not been very obvious. I think the two proposed post holders will have to really help the groups in need and help them move up the social ladder. It doesn't matter what post you're creating. The key is secretary, you yourself, and the chief secretary for administration. People are facing problems of poverty because costs of housing and transportation are high in the mainland. There are stringent and strict indicators to tackle poverty. In 2015, the State Council mentioned that to evaluate the effectiveness of poverty alleviation, we have to look at not only the quantity and quality. We should not set unrealistic indicators, and we have to make the people responsible accountable. I do not object to the creation of the two posts. What is important is whether they can really achieve the targets. If no effectiveness has been achieved, what should the government officials do? Should they be held accountable? Haven't there been officers under LWB to evaluate the effectiveness of poverty alleviation? Why are you proposing the creation of Principal Economist to gauge the effectiveness of poverty alleviation? Secretary, we will not only rely on these two post holders to tackle poverty. They are two of the directorate officers who are going to help tackle poverty only. At the top level, it is the Chief Secretary of Administration to lead the work of poverty alleviation. I myself as well. In the coming year, we're going to see a lot of interdepartmental efforts to tackle poverty. We need the efforts not only of LWB but other government bureaus and departments as well. We have studied the effectiveness achieved in the mainland in terms of tackling poverty. We have to understand that the economic situation in Hong Kong is different from that of the mainland. We are at an advanced economy. We've spent a lot of money. Well, this year we've spent about $120 billion on alleviating poverty. But this is not enough. We're not only alleviating poverty, we're also offering support to the vulnerable groups. For those who are living in undesirable living conditions or environments, we have to think about how to help them as well. We need economists to help us, but we cannot take up all the work. I mean LWB itself. Perhaps I can invite Mr. Hao to explain more. Thank you, Dr. Chow, for the question. Poverty is a complex and wide issue. We need a directorate officer to lead a team of people to tackle poverty. Dr. Chow asked why we're only proposing the creation of this post now. It is not a new post. In 2013, when the Commission on Poverty was first established, we already had this post. In 2016, we extended the post for 3 years. In 2019, due to the political situation or social situation, we did not extend the post. However, after that, through internal redeployment of staff, we continued to provide support to LWB in this respect. After reviewing the situation, we think that it is not feasible to handle the work this way. So that's why we are proposing this post again for 3 years. Thank you. I understand that it may be a time limit post, but I think we should consult other parties as well, including scholars or the academic sector. I think we have to draw reference from the way the mainland tackle poverty in a targeted manner. Next, Mr. Shanghai Long. I give my support to the creation of these two posts. According to paragraph 7 of the government's paper, it stresses that poverty work has to be taken forward in a targeted manner. I understand that we need technical staff to offer support. Looking at the database of the government and comparing it with the way the mainland authorities tackle poverty, well, according to the government's paper, it is mentioned that the government only looks at the data or figures provided by the Census and Statistics Department and OGE. I hope that the government, with the creation of this post, can look at more data. The care teams will be deployed across 18 districts. I hope that there can be more data analysis and sharing between different parties, and that the directorate officers proposed can better grasp the poverty situation in Hong Kong. I remember Secretary mentioned that work from home is a feasible approach for single parents and those who need flexible working hours after COVID. I wonder what the administration has been doing. Can you give some sort of rewards to or incentivize the business sector to offer flexible working hours? Secretary, in terms of data, we strive to build a better database for us to have a better grasp of the poverty situation in Hong Kong. I noted that in mainland, they have their own ways to tackle poverty, and we can draw reference from that. We'll see whether it's feasible to apply the same method in Hong Kong. We'll look into it. We will definitely work closely with care teams. Well, there are care teams deployed in 2 districts already. We will make good use of the infrastructure and the manpower available to take forward our work to help the elderly. So we will work closely with the care teams in this regard. Also, I have explored with the business sector the question raised by Mr. Shang. For instance, for single women who have been receiving CSSA and who have not been working for a long time, it's hard for them to step out of their comfort zone right away. So it may benefit them if they are able to work from home. In terms of how we can take forward or implement these flexible work measures, we'll have to continue to explore that with the business sector. Any follow-up questions? No. Next, Ms. Carmen Khan for the second round. My question for the administration is the differences between the posts proposed this time and the posts you proposed to create last time, which also have to do with poverty alleviation work. Can you briefly explain that? How do we define targeted poverty alleviation? I think we can consider teaching people how to get out of poverty. So I think that this post proposed may not need to be expanded after 5 years. Also, according to paragraph 7 of the government's paper, it sets out clearly what the principal economist will do, including identifying vulnerable groups in the society. That is, you can identify those who need help. I hope that this can be bilateral in the sense that it is not only the administration who can identify the vulnerable groups, it is also the vulnerable groups that can also identify the support given by the government. Well, there are different government bureaus who are involved in tackling poverty. So how will LWB work closely with the other bureaus to tackle poverty? Also, the Principal Economist proposed will work under FS, and I hope that the post holder will liaise closely with other government departments or bureaus. Secretary, thank you, Ms. Khan, for the question. Our original intention is to combine the posts created in one government papers, but we decided to split it into 2 government papers in the end. One is about manpower and the other is about the human resources we need and the talents we need. So what are we going to do after 5 years when the proposed post lapses? We propose to create the D2 post for 5 years. However, it doesn't mean that we do not think that poverty alleviation work needs not to be done after 5 years. So we will take forward the work in this current term government. For the work to be taken forward in the next term government, we'll wait for the leaders of the next term government to explain. How can we take forward poverty alleviation work in a targeted manner? Well, in the past, we only look at people's income, and we only look at relative poverty. In this current term government, we think that the first step is to first identify the target groups, because there are different needs from different target groups, so that we can come up with indicators to measure poverty. Thank you. Next, Mr. Lai Tong Kwok for the second round. There are no other members who would like to ask questions, is that right? If not, Mr. Lai will be the last member to ask questions in the second round. Thank you, Madam Chair. I have further suggestions and one other question. I've heard the administration's views. I understand that it is very complex to decide how you're going to place the poverty line. The administration mentioned that the Principal Economist post will be created for 3 years. I think you have to think carefully whether you need to extend the post in an appropriate manner so that you get enough support from the OGE. Otherwise, it will really affect your work in tackling poverty. Also, I'd like to ask the Secretary how you are going to work with the policy unit of the Chief Executive Office. I believe that the policy unit will be able to provide many precise and targeted advice to your bureau.
Thank you for your suggestion. We will review the need as necessary and as soon as possible. We won't be only doing that in 3 years' time. Second, on interaction with the Central Policy Unit. Well, I've been in touch with members of the unit, and for them, they are making suggestions on a macro level. In the Commission on Poverty, there are representatives from different sectors, including the industry and the academia. So for poverty alleviation, we believe that these policies should be handled and should be proposed by the COP, but we will continue to liaise with Mr. Stephen Wong. Any follow-up, Mr. Lai? No. Since there are no other questions, I will now put this item to a vote. Those who are in favor of the proposal set out in EC 2022 to 2321, please raise your hands. So all members have raised their hands. Any who are against the proposal? No. Then I believe that all members endorse this proposal. Now, we have to vote on whether or not we recommend further discussion by the Finance Committee. According to Rule Paragraph 2 of the Establishment Subcommittee, we have to decide whether or not we recommend further discussion by the Finance Committee. Now, according to Rule 40A of the ESC rule, I'm now putting this motion to a vote. We recommend further discussion by the FC of the item set out in EC 2022 to 2321 and endorsed by this subcommittee. I remind members that if this motion is passed, that means members of the ESC recommends further discussion by the FC of this item. If this motion is denied, that means the subcommittee does not recommend further discussion by the FC. Those who support the motion, please raise your hand. No one. Those who are against? All except 2. So this motion is denied. I believe that we have a majority against the motion. Now, agenda item 2. Proposed creation of a new 1-rank grade and 1 permanent post non-civil service position of Commissioner for Chinese Medicine Development, D2, in the Health Bureau, with effect from 1st of April 2023 or upon approval of the Finance Committee, whichever is later. We have to wait for the approval of the Finance Committee to promote in a focused manner the development of Chinese medicine in Hong Kong on all fronts and strengthen the coordination of Chinese medicine-related tasks at the professional and policy levels. The administration has consulted the panel on health services on the 10th of February this year. And today with us here, Mr. Thomas Chan, Permanent Secretary for Health, and Mr. Eddie Lee, Deputy Secretary for Health. Mr. Tommy Chan is the chair of the panel on health services, but he is not here today since he is not a member of this subcommittee. So, I will brief you on the salient points of discussion. The panel on health services has on its meeting on the 10th of February 2023, discussed the proposal to create a permanent position of Commissioner for Chinese Medicine. The members have no objection to the submission of the proposal to the ESC. Many members believe that the Commissioner has to have professional background in Chinese medicine, Perhaps they should be registered Chinese medicine practitioner, holder of relevant academic qualifications, background in science and research, clinical experience, and knowledge of public healthcare policies. And we should not have a lay person in charge of professionals. And members believe that the commissioner should be hired through open recruitment. And members expect that the commissioner can help Hong Kong develop its own brand of integrated Chinese Western medicine and achieve international recognition. And they also hope that the commissioner can push for plans to allow further mainland practice for Hong Kong Chinese medicine practitioners. On this, they request the entry requirements of the above positions to be made public to the ESC. And members are concerned about pushing ahead Chinese medicine's development in Hong Kong. Chinese Medicine Development Blueprint, Integrated Chinese Western Medicine Services, Chinese Medicine Hospital Services, use of EC Connect, and the financial position of the Chinese Medicine Development Fund and the training of Chinese medicine practitioners. And the administration has made responses in a meeting. The administration has provided additional information regarding the entry and requirements of the commissioner, and the details are set out in EC 2022-23-22 Annex 2. There are 8 members wishing to speak: Mr. Lai Tung Kwok, Professor Chen Wing Kwong, Dr. Lo Wai Kwok, Dr. So Chan Wing, Mr. Lee Chun Kang, Mr. Holden Chow, Mr. Chow Siu Chung, and Mr. Chu Kwok Kang. 8 minutes. 5 minutes each. Mr. Lai Tung Kwok. Thank you. Well, my questions is about Annex 2 or Enclosure 2, tentative entry requirements of Commissioner for Chinese Medicine Development. For number 3 and 4, they require the post holder to have a bachelor or postgraduate degree from a university in Hong Kong or equivalent and academic or professional qualification related to Chinese medicine, and being a registered Chinese medicine practitioner with a Chinese Medicine Council of Hong Kong. I would like to know whether these 2 requirements must be met for the candidate. Permanent Secretary? Yes. For requirements 3 and 4, we would like the candidate to fulfill these 2 requirements. But I would like to stress that these requirements are tentative only. Of course, we want to be able to recruit candidates who fulfill all of these requirements. But during the recruitment process, we may need to make appropriate adjustments depending on the caliber of the candidates. Thank you. How about requirement 5, at least 12 years of professional, administrative, and/or management experience related to Chinese medicine? I would like to know, for administrative and/or management experience, are you referring to experience related to Chinese medicine? Is that a must? For requirement 5 on the list of tentative entry requirements, we require candidates to have at least 12 years professional, administrative, and/or management experience. Yes, we would like these experience to be related to Chinese medicine, but the scope is rather broad. There are many Chinese medicine clinics, both in the public and private sectors. And in our healthcare systems, there are certain clinics providing Western medicines, are also providing Chinese medicine service at the same time. So these experiences are also counted. The paper stressed that they would like to hire from the outside, but you also mentioned that you would consider serving civil servants. So I would like to know, are you aware of any suitable candidates in the existing civil service who fulfill the entry requirements? Permanent Secretary? For the creation of the Commissioner for Chinese Medicine Development, this is actually to take over the place of a Chinese medicine unit. It was a D2 position held by an AO. But after learning from this experience, we find that we do not really have a candidate with the suitable Chinese medicine background to fill this position. That's why we would like to seek your support to create this post and identify suitable candidate. I would like to add that if within a short period of time we cannot identify a suitable candidate, and if we need more time to do that, for the duties listed in paragraph 4, they will still be carried out by the Chinese medicine unit. So we do not rule out the possibility of deploying a civil servant to take up these duties. Mr. Lai, for the duties set out, they have to oversee policy matters in relation to the legislative framework on Chinese medicine. I would like to know whether the post holder will be helping the Chinese medicine sector to fulfill their demand. Let's say Chinese medicine practitioners cannot refer patients, let's say for an X-ray examination. So will the post holder be helping the sector in fulfilling their other duties? One of the major responsibilities for the post holder is to develop a Chinese medicine blueprint for the professional development of Chinese medicine. We want to set short, medium, and long-term recommendations. One of the important indicator of whether or not the blueprint is effective is that we want to incorporate Chinese medicine in a system where Western medicine is the mainstream. We want to see whether certain services can incorporate Chinese medicine elements as well. This will be the areas of focus. Next, Professor Chen Wing-Kwong. I have a declaration to make. I'm a member of the Board of Directors of the Chinese Medicine Hospital. I support the creation of this post to support the development of Chinese medicine. I thank Mr. Lai Tong-Kwok for raising certain questions. I wanted to ask those questions as well. For the entry requirement, I believe that we need to keep the requirement of the post holder having a bachelor degree or professional qualification related to Chinese medicine. I think we need to uphold this requirement. And in paragraph 9, just then, PS has mentioned that the entry requirements may be adjusted if suitable candidates cannot be identified. I would like the administration to promise that the requirement of professional qualification must not be abolished, because we do not want lay people to be in charge of professionals. And for the coordination of Chinese medicine policies, I believe that this post is similar to the director of the Chinese medicine unit, because both of them answer to the Deputy Secretary for Health, and both of them are D2 positions. For the commissioner, there are 18 support staff, including non-directorate staff and staff on non-civil service contract. Since Chinese medicine is such a broad topic, will the administration consider hiring more manpower to handle this area?
Permanent Secretary, thank you, Mr. Chen, for the question. The first question is about the requirements for Commissioner for Chinese Medicine Development. We have taken into consideration the views of members of the Chinese medicine sector. We hope that the candidate will have experience and qualification related to Chinese medicine. On the question about the existing head of the Chinese medicine unit, it was created as a 5-year post in 2018. The post will lapse on the 1st, or the post has already lapsed on the 1st of April. The head of the Chinese medicine unit was not only overseeing Chinese medicine development. The head also oversaw policy matters on oral health and other projects. And over the past years, when there was the epidemic, like other colleagues in the bureau, the head also took care of anti-epidemic work. So the Commissioner for Chinese Medicine Development post proposed will take forward work in relation to the development of Chinese medicine. Currently, for non-directorate officers, we have a total of 6 of them, including 5 civil service posts and 1 non-civil service post. We will expand the establishment of the Chinese medicine unit to support the development of Chinese medicine, and we will have 23 officers, including 8 civil servants as well as 15 non-civil service contract staff. Madam Chair, I have a follow-up question. Can the administration undertake not to lower the entry requirements for the proposed commissioner in relation to the academic or professional qualification of the candidate? What to undertake? Can the administration undertake not to lower the entry requirements of the proposed commissioner post in relation to his or her academic or professional qualifications? Understand that there are many people in the Chinese medicine sector who may be able to fulfill the requirements, but if you do fail to look for such candidate, please do not lower the relevant entry requirements set out here. Can you undertake that? Well, we will, in accordance with the entry requirements set out here, to look for the right candidates. We really hope to be able to hire someone who can fulfill all the requirements listed out here. If not, we will still look for someone who has the relevant academic or professional qualifications required. That is, with academic qualifications relation to Chinese medicine. Is that right? Yes, this will be one of the requirements. Next, Dr. Lo Wai Kwok. I speak in support for the proposed creation of the post of the commissioner for Chinese medicine development. You need a dedicated senior officer within the administration to promote the development of Chinese medicine. However, even with such commissioner, are you able to really take forward your measures or initiatives in relation to Chinese medicine? Madam Chair, my expertise is in engineering. Chinese medicine is not my specialty. However, I have taken part in the work of Chinese medicine. In 1997, I was the chair of an association in Hong Kong. I was one of the first group of people in Hong Kong to visit the mainland, and I had the opportunity to meet with some Chinese medicine experts in the mainland, and I have invited a number of times these experts to come and visit Hong Kong for exchanges. I also organized summit to promote exchanges between Chinese medicine practitioners in Guangzhou and Hong Kong. In my family, 2 elderly members had problems with their spines, and in Foshan there was a hospital with Chinese medicine practitioners who could take care of patients with these problems, and 95% of the patients were cured without having to undergo surgeries. These 2 elderly members have passed away now. However, before they passed away, they were not troubled by the spine problem anymore. So that was my experience with my family members. I was a member of the board of the hospital authority as well, so I had the chance to take part in work related to Chinese medicine. I think the development of Chinese medicine in Hong Kong has been very slow. We still haven't seen the completion or commissioning of the first Chinese medicine hospital in Hong Kong. I don't think we'll be able to see that until 2025. We've been talking about promoting Chinese medicine development, but we're seeing such slow progress in commissioning our first Chinese medicine hospital. There have been complaints within the Chinese medicine sector. There are views that there are courses provided to young people in Hong Kong. However, it's been difficult for them to arrange for internship opportunities to the students. They have to send the students to the mainland. When I was young, when I went to see Chinese medicine practitioner, there were X-ray services provided. There are different treatments provided by Chinese medicine practitioners and Western medicine doctors. However, I know that Chinese medicine practitioners can also offer services such as ultrasound scanning. However, in Hong Kong, Chinese medicine practitioners are only restricted to offering traditional Chinese medicine treatments. That's all I want to say. My major point is that if you do not relax the relevant measures, it doesn't matter how many commissioners for Chinese medicine development you hire, you will not be able to achieve your goals. Permanent Secretary, the administration has clear targets in developing Chinese medicine. In the 2022 policy address, the chief executive made it clear that coordination within the administration will be taken forward to develop Chinese medicine. And Chinese medicine will be treated as the same as other professional medicine services and incorporated into the regular healthcare system in Hong Kong. That's our direction in taking forward our policies. Next, Dr. So Chen Wing. Madam Chair, we have to bring into play the advantages of Hong Kong for having both Chinese and Western cultures. I speak in support for the proposed creation of the Commissioner for Chinese Medicine Development post. My question is, in Hong Kong, there is complete promotional letter for Western medicine sector. For Chinese medicine development, I think it is key that we have a complete system in place. Will there be indicators to measure the work of the proposed commissioner? On one hand, we have to have a complete system in place to ensure that there is a complete promotional letter for Chinese medicine practitioners in Hong Kong to ascertain their status or legal status in Hong Kong or statutory status in Hong Kong. Also, we lack of a standard for Chinese medicine development. If we do not make improvement in this regard, like what Dr. Low said, we have to relax our restrictions, and there should be a standard within the Chinese medicine sector for the commissioner's role to be brought into full play. My question is whether the administration has the relevant indicators set for the proposed commissioner. Permanent Secretary, regarding the registration of Chinese medicine practitioners and on nurturing and training of future talents and how we can expand Chinese medicine sector, these will all be overseen by the proposed commissioner as he or she formulates the blueprint for Chinese medicine development. In terms of establishing promotional letter for Chinese medicine practitioners and the other problems I mentioned, these will all be covered under the blueprint. On proprietary Chinese medicine in Hong Kong, the Chinese medicine sector stresses an approach that is Chinese medicine based. So moving forward, we have to look into how we can take forward this Hong Kong-based approach to deepen our collaboration with the mainland in areas of Chinese medicine development. We will bring forward the advantages of Hong Kong and act as a role as an important window into the mainland to internationalize Chinese medicine development. In Hong Kong, we want to develop an evidence-based approach and create systems for the Chinese medicine development and incorporate into our healthcare system in the long run. Next, Mr. Lee Chen-keung.
I'm sure that many members of the public have benefited from Chinese medicines, especially during the pandemic, especially for post-infection treatment. We all saw how effective Chinese medicine was. Our country has been actively promoting the internationalization of Chinese medicine. It is saddening to see the Chinese medicine development in Hong Kong. Only today have I realized that the administration is aware of the fact that we need to have a Chinese medicine practitioner-led approach, and that lay people should not be in charge of professional CM practitioners. We are lagging behind. If we look at neighboring regions, let's say Macau, how are we going to compete with them or to collaborate with them in terms of accreditation and quality control? They already have a series of measures in place, especially for the state key laboratory on Chinese medicine. Many renowned pharmaceutical companies have already invested in this product chain. So, what are we doing in that regard? And for the post of Commissioner for Chinese Medicine Development, I understand that this position will be filled through open recruitment. Just then, Professor Chan said that he hoped the requirement of professional qualifications would not be dropped. I would like to know, there are 8 assistant commissioner for Chinese medicine development. So I would like to know, what will the division of labor be like regarding promotional strategies, professional background, and development? Permanent Secretary. Thank you for your question. On quality control of Chinese medicine, together with the Chinese Medicine Hospital, we are going to establish a Chinese medicine testing center. Like I said, together with other regions in the GBA, let's say Macau or Guangdong province, information exchanges are very important, and we have been in constant liaison with them. They are also very concerned about the development of Chinese medicine development. We would like to promote Chinese medicine development using a practitioner-led approach. In the coming days, through the Commissioner for Chinese Medicine Development, we want to be able to coordinate with the overall development plan of Chinese medicine. As for staff with professional Chinese medicine background, I'll invite Deputy Secretary to answer. Well, just then we mentioned that there will be 15 non-civil service contract staff. We hope that they would all have professional background in Chinese medicine so that they can support the Commissioner. And with their professional background, we want them to assist in the development of professional training and for Chinese medicine and proprietary Chinese medicine, how are we going to promote them to the mainland and internationally? Chair, a follow-up question. If you cannot identify suitable candidate after open recruitment, do you have any backup plans? There is a certain degree of urgency here. Permanent Secretary. Well, if the proposal is passed, then the Commissioner for Chinese Medicine Development will be filled immediately. We are confident in securing a candidate who fulfill all our requirements. But if the candidates cannot fulfill all of the entry requirements, we will consider adjusting the requirements. But our goal is to identify a suitable candidate with a Chinese medicine background to fill this position. I hope that when you adjust your entry requirements, you can talk with representatives of the sector. Don't lower the requirements too much. Thank you. Next, Mr. Holden Chow. Of course, I support the creation of this post of Commissioner for Chinese Medicine Development. Just then, Professor Chen gave a lot of concrete suggestions because we would like to have someone with a professional background related to Chinese medicine to fill this position. From paragraph 10 of the paper, there are 8 officers in non-directorate civil service posts to support the Commissioner. In enclosure 3, in the chart there, can you tell me where the duties fall? Because when I look at the chart there are more than 8 officers. There are policy development section, service development section, public education and stakeholder liaison section, professional development section, and there are many supporting positions. So I would like to know, where will the 8 positions mentioned be distributed? That is my first question. Second, when I refer to your chart, for policy development section and service development section, I think for them, their major duties should be on how to relax limitations on Chinese medicine development in Hong Kong. There were many examples raised. After a consultation with a Chinese medicine practitioners, a patient cannot be referred to receive other treatment. So the limitations are still there. If I refer to the 4 sections there, I think that perhaps the policy development section and service development section will be responsible for that. There are 2 assistant commissioners for these 2 sections. You said that you want to strengthen the role of the commissioner. But from the chart, I can see that there are assistant commissioner positions as well. And there are chief executive officer under service development section. So I would like to know, would this position be filled by people with Chinese medicine background? Because for these 2 post holders, they may be responsible for relaxing the limitations that we have just talked about. Otherwise, we may not see the results that we want, that is to relax the limitations. If we want to see development in Chinese medicine, then we need to break down all these constraints and limitations. If the post holders do not have the relevant experience in Chinese medicine, they may not be able to achieve the results that we hope for. So can you explain this to us? Permanent Secretary, thank you. In the future, the Commissioner for Chinese Medicine Development will lead the Chinese medicine unit. So all of the staff members will answer to the Commissioner, and all of them will have Chinese medicine background. and have to fulfill our requirements. Mr. Chow's concern was that the CMU may not be able to relax limitations on Chinese medicine. Well, I can assure you that that will not be the case. We will strike a balance there. There will be 15 staff members with Chinese medicine background. In the organization chart, for Chinese medicine officers, they all have backgrounds in Chinese medicine, but we need other supporting staff, including administrative officer, executive officer, personal secretary, etc. They account for 8 staff members. That is about 1/3 of the overall establishment. Mr. Chow was concerned about the policy development section and the service development section. If you refer to the job duties there, they are mainly engaged in the legislative framework, Chinese Medicine Development Fund, Chinese Medicine Hospital, and the Government Chinese Medicine Testing Institute. These are administrative matters. That's why we'll have an administrative officer taking up the post. As for your other concerns, in the Chinese Medicine Development Blueprint, after policies have been formulated, no matter which section is responsible to follow up on those policies, I'm sure that they can be done with effectiveness. Next, Mr. Chao Siu-chung. Chair, in principle, I support the government's proposal that is the creation of a post of Commissioner for Chinese Medicine Development. Through this arrangement, I hope that we can promote the all-round development of Chinese medicine in Hong Kong. I'm sure you understand that for grassroots members of society, they have simple expectation for Chinese medicine. All they want is to be able to see a Chinese medicine practitioner with a shorter waiting time and at a lower cost. And I hope that you can help them achieve this. For Chinese medicine clinic, each consultation costs $120. Many people have told me that that is quite expensive. Will you consider lowering the cost to match that of Western medicine clinic, that is at $50? And to promote the development of Chinese medicine, the training of practitioners is important. For the Chinese medicine clinic in 18th district, the utilization rate is much higher, from 1.2 million people in 2018 to 1.5 million people in 2022. These clinics provide 3-year internships for Chinese medicine students. Other than providing internship opportunities, is it possible for these clinics to hire locally trained Chinese medicine graduates? We can expand the scale of these clinics, and we can also encourage local students by doing so. Thank you.
Permanent Secretary, thank you, Mr. Chow, for the question. As mentioned, one of the major tasks of the Commissioner is to work with the Chinese medicine sector to formulate the blueprint for Chinese medicine development. as to how we can enhance the status and standards of Chinese medicine sector and incorporate the entire Chinese medicine service into our healthcare system. For instance, how we can relax the relevant restrictions and integrate Chinese medicine services with our existing professional medical services. This is one of the important tasks to be dealt with by the Commissioner, and we will give our full support to the proposed Commissioner. On the question about Chinese medicine outpatient services, we are going to increase the annual quota of government-subsidized Chinese medicine outpatient services to 800,000 for low-income families. There are waiver of the charges, so we have no intention to lower the outpatient services fees. We think that $120 is quite reasonable. For students who have completed internship programs, a lot of the clinics will hire local graduates. For these 18 Chinese medicine clinics, that is their role in our primary healthcare system. I think I'll leave this question to the proposed Commissioner to decide with members of the Chinese medicine sector as they formulate the blueprint together. Any follow-up questions? No. Next, Mr. Chu Kwok-keung. Thank you, Madam Chair. I support the proposed creation of the Commissioner post to lead the Chinese medicine unit. I believe citizens of Hong Kong look forward to having this Commissioner on board. If we can have a dedicated staff and a regular staff to take care of the Commissioner post, that would be ideal. I see that the administration has to do a lot of this work from scratch, and the work to be taken forward is challenging. For instance, for the integrated Chinese Western medicine services, the development progress in Hong Kong has been slow, and there is need to strengthen the effort in this regard. For this proposed Commissioner, aside from having the required academic or professional qualifications as listed out in the government paper, does the person have to have certain knowledge in Western medicine as well? For the 8 directorate officers or non-directorate officers proposed, will one of them have to, or at least one of them have the knowledge in Western medicine, so that the team can help develop Chinese medicine in a more comprehensive manner? Integrated Chinese Western medicine services in the mainland have been developing quite well. How do we draw reference from the practices in the mainland and their wisdom to enhance the development of integrated Chinese Western medicine services in Hong Kong? Thank you. Permanent Secretary. Currently, under the Chinese medicine unit, we require the proposed Commissioner to have the relevant background in Chinese medicine. But as mentioned, there are people who work in organizations who have or that provide Chinese and Western medicine services, and this will be an advantage of these people. So we will take this into consideration when we conduct the recruitment exercise. And also, as mentioned, the Commissioner will have to have the professional qualification or background in relation to Chinese medicine. As for the other non-directorate posts proposed, we are targeting those who have the background in Chinese medicine. For the Chinese medicine officer posts proposed, we require the candidates to have background in Chinese medicine. As to whether we will look for professionals with Chinese or with Western medicine knowledge, I think we'll make the relevant adjustment if the non-directorate officers proposed require such professionals' support. Will you give priority to those with Western medicine background and as you recruit? As mentioned, we'll adhere to the principle of meritocracy as we recruit our staff. We will look for suitable candidates to help formulate the blueprint to take forward the development of Chinese medicine in Hong Kong. The key is how we can incorporate Chinese medicine services into our healthcare system. So those with Western medicine background will have an advantage. However, we'll have to look at the backgrounds of the candidates we have to make a decision. Next, Ms. Elizabeth Quat. Thank you, Madam Chair. All along, we've been supporting the development of Chinese medicine. For a period of time, we heard views from the Chinese medicine sector that a lot of the officials within the administration who take forward the relevant work are laymen. They aren't professionals. The administration attaches importance to the development of Chinese medicine, and I give my support to the proposed creation of this commissioner post. The key is that the commissioner will be able to take forward the work effectively so that we see the development of Chinese medicine in Hong Kong. One of the requirements for this commissioner is to have the academic and professional background in Chinese medicine and have at least 12 years of professional experience related to Chinese medicine. According to government's paper, it is mentioned that it depends on whether the administration is able to look for the suitable candidate. So our concern is whether you will end up hiring someone without a Chinese medicine background. I hope that the administration can undertake, again, not to look for some layman to lead or manage the professionals. We all have expectations on the administration's work. There are still a lot of issues to be resolved. We've been reflecting to the administration in relation to the issue of healthcare services that cannot be referred to or by Chinese medicine practitioners. Does the administration have a timetable in this regard? Also, according to the government's paper, the administration will develop the Chinese medicine clinics, training and research centers in the 18 districts. We have visited the clinics, and some Chinese medicine practitioners said the working environment is not perfect, and the salaries that they get are much lower than that compared to Western medicine doctors. How are you going to retain talents to work in these clinics and training centers? How are you going to attract talents to join the industry? If you are unable to retain talents, you won't be able to see the development of Chinese medicine in Hong Kong. Permanent Secretary. Thank you, member, for the question. I'd like to stress that starting from 2018, we created the Chinese Medicine Unit. It was headed by an administrative officer over the past few years. However, we did see progress made over the past few years since 2018, including the setting up of the Chinese Medicine Development Fund, which funded a lot of large-scale research and projects. Also, on surface referral or treatment referral, these works were all taken care of by the Chinese medicine unit and the head of the unit. So we had to commend the work done by our colleagues. The chief executive mentioned the creation of the post of commissioner in his policy address last year. In our paper, we mentioned that there has to be a certain level of flexibility in our recruitment exercise. We do hope to look for someone who can fulfill all the requirements as set out in the paper. However, in reality, will such a candidate really take up such job or take up the post of the commissioner? As mentioned, the candidate we look for will have to have the background in relation to Chinese medicine. We hope that such a candidate can fulfill the other entry requirements as well. The other questions raised by Ms. Quat will be explored by the future commissioner and members of the Chinese medicine sector as they formulate the blueprint for Chinese medicine development. These questions include promotional letter for Chinese medicine practitioners and training of talents, etc. These are all important parts to be included in the blueprint. As to why we want to have the commissioner formulate the blueprint, it's because we want to have a complete blueprint for Chinese medicine development. In the past, we discussed issues separately. Now we want to have a complete picture of the sector and the Chinese medicine development. Next, Mr. Edmund Wong. I speak in support for the proposed creation of the post of the commissioner. I heard the administration say that they are looking for someone with at least 12 years of professional background in relation to Chinese medicine. It won't be too difficult for the administration to look for such person because the Chinese medicine department has been set up for some 20 years in the Baptist University now. However, it will be difficult for the administration to look for a Chinese medicine or someone with background in relation to Chinese medicine as well as Western medicine knowledge. Perhaps they'll have to look for such candidates in the mainland, and I wonder how many of such candidates we have in Hong Kong. Also, I have a follow-up question on the question about referral. For physiotherapists, we are scrutinizing the bill to allow referral to be made directly by physiotherapists. So I wonder if the same can be done in Chinese medicine. Permanent Secretary. In Hong Kong, in academic and the Chinese medicine sector, there are many talents with Chinese medicine background. So we're optimistic that we'll be able to look for the right candidate to fill the post of the commissioner. And the mainland, Chinese medicine practitioners often have background or qualifications in relation to Western medicine as well. So this is different from the situation in Hong Kong. As mentioned, we want to make good use of the advantages of Hong Kong and develop Chinese medicine in a Chinese medicine-based approach. We want to look for someone with primarily Chinese medicine background to fill the post. with Western medicine knowledge, it will definitely help the candidate fulfill the targets of this post. So we hope that we can look for such candidate. As to align Chinese medicine services with other professional healthcare services, we've been taking forward the work in this regard. First, we will have to take a professional-based approach with the auxiliary professional healthcare services within the Chinese medicine sector. We'll have to look at whether there is enough training in place to train the professionals. If we want to incorporate Chinese medicine into our healthcare system, we'll have to remove the relevant restrictions. At the same time, we'll have to rationalize issues in relation to training of professionals and responsibilities of the professionals to ensure services provided to patients are guaranteed, and this will be one of the tasks to be dealt with by the Commissioner in the future. And we've been continuing with our consultation work.
Mr. Wong, just then the administration said that consultation has been going on. I would like to know whether there is any concrete timetable. And just then the administration has mentioned this 3 times. That is, we want the Chinese medicine services to integrate with Western medicine because they can complement each other. Thank you. Next, Mr. Dennis Leung. Chair, under the one country, two systems, we have to learn from our country in terms of policy direction. We need to be confident in our medical services. Before the handover, since the majority of our people are Chinese, we depended on Chinese medicine for treatment as well. So, of course, I support the creation of this position of Commissioner for Chinese Medicine Development. If it can benefit Hong Kong people, of course, I'm in favor of that. I would like to know, have you ruled out the possibility of hiring mainland talents to come to Hong Kong to fill this post? We have the Top Talent Pass scheme. If we cannot identify suitable candidates in Hong Kong to fill this position, will you employ talents from the mainland through the Top Talent Pass scheme? And I believe that there are certain restrictions posed by the Western medicine services on Chinese medicine. So we want to be able to utilize other medical tools when practicing Chinese medicine. Permanent Secretary, does a civil servant have to be a permanent resident of Hong Kong? Chair, in our entry requirements, it is set out that the candidate must be a permanent resident of Hong Kong. According to the basic law, in general, a civil servant must be a permanent resident of Hong Kong. But for certain post, exemptions can be made. We really would like to employ a candidate with local Chinese medicine background and experience to fill the post because they understand the overall Chinese medicine development in Hong Kong and the development of our overall medical system. That would be very helpful in pushing ahead with the Chinese medicine development in Hong Kong. But if we have difficulty in recruiting such a candidate, then we do not rule out the possibility of hiring from other places. But local talent will be our top priority. And we are not talking about restrictions posed by Western medicine services on Chinese medicine services. For all medical services, if they need to utilize other medical services, then they have to go through a certain professional protocol with standards and restrictions in place. Just then, Professor Chen mentioned referral services for X-ray, etc. In our consultation, for CM practitioners and radiographers, they agree that we need to set out standards and restrictions. As for other medical tools and services, the general principle is the same. With sufficient training in place, Chinese medicine practitioners should be able to refer patients to these other health services. Any follow-up? No, thank you. So now we have 3 more members waiting to speak. I will extend the meeting by 15 minutes. I hope that we can conclude this item. Ms. Carmen Khan, I speak in support of the creation of Commissioner for Chinese Medicine Development. We need to have a dedicated person to take forward the development of Chinese medicine. In enclosure 1 and 2, the job description and entry requirements are set out. I would like to know that the head of the Chinese medicine unit, for this position, it has lapsed on the 1st of April. It was taken up by an administrative officer. Will you consider transitioning this previous post to the new one? Since from what I've heard so far, it seems that it is not a must to have a professional to take up this position. I hope that you can uphold the requirement of having professionals leading the Chinese medicine development. And for the language requirement, you need to have strong command of written English and written Chinese and proficiency in Cantonese, Putonghua, and spoken English. Well, I agree with this because they have to be able to communicate with people not only in Hong Kong but also in mainland. For Chinese medicine professionals, I don't think that English skills are necessary. I don't want this to pose any unnecessary obstacle in your recruitment process. Permanent Secretary, originally, the head of the Chinese medicine unit, the post has lapsed on the 1st of April. So starting from the 1st of April, this position no longer exists. But for other colleagues there, they have been continuing with their work. That's why we are so anxious to create this new position of commissioner. We have been waiting in line for a while now. Upon the approval of the Finance Committee, we will start the recruitment process for the commissioner immediately. And we will adopt the tentative entry requirements set out. So with the Chinese medicine qualification and the background, they will be part of the requirements. As for the language requirements on English and Chinese, we are still looking for candidates who are fluent in both Chinese, English, and Cantonese. So we would like to secure a candidate who is fluent bilingually. And of course, we understand that we may not be able to identify a candidate who fulfill all the requirements. So we will try to strike a balance when we adjust the requirements if necessary. As for the Chinese medicine related background and experience, they will only be adjusted as a last resort because they are very important to us. As for the years of experience, perhaps they can be adjusted as well. Perhaps they can be replaced by experience in other sectors. Any follow-up? Chair? From what I've heard so far, every member who has spoken is concerned about the professional background of this post holder. And I'm glad to hear that this is one of the top requirements. In terms of flexibility, I think you can make adjustments in other requirements such as the language requirements. Any response? Yes, we will take that into consideration during the recruitment process. Next, Mr. Tang Fei. Chair, a few questions. From paragraph 4A of the paper, the Commissioner will jointly formulate with the CM sector a blueprint for the overall development of CM. Well, I would like to know whether there are any KPIs in place, any roadmap and timetable. If there is none, then the discussion can go on forever. We should at least have a roadmap. And in January this year, I've read from the news that the government is planning to amend the law in terms of when it comes to allied health services so that they can refer patients to other professional services. I would like to know whether works on this front is included in the blueprint. Let's say if a Chinese medicine practitioner can refer their patients to receive treatment and tests, including blood tests, etc., how will the reports be handled? Will the report be referred back to the Chinese medicine practitioner so that the patient can receive follow-up treatment in Chinese medicine? Or will the report be handed over to a Western medicine practitioner? I'm concerned about what the follow-up actions will be after the referral. This is a key issue that needs to be solved when it comes to integration between Chinese and Western medicine. And I understand that our country has done a lot in Chinese medicine development. For example, the digitalization of Chinese medicine index. Our country has already compiled an index of Chinese medicine in digital form. So do we have to start from scratch? Is it possible for us to borrow from their example or experience? Permanent Secretary. Originally, our intention was to have a seamless transition on the 1st of April so that the commissioner can take up the post on that day. But since we are behind schedule, the post remained vacant. We hope that we will be able to identify suitable candidate by the second quarter of this year. Then we can start the consultation process of the development blueprint. But we hope that by the end of this year, we'll be able to collect views from different stakeholders regarding the blueprint, and we'll be able to complete the first edition of the blueprint. For Chinese medicine, Western medicine, and their collaboration with other health services. And how are we going to enhance the collaboration between Chinese and Western medicine? And how to expand cancer care to bring the advantages of Chinese medicine into full play? All these will be considered in the blueprint. We understand that this is no easy task, and ample time is needed for the Commissioner for Chinese Medicine Development to liaise with the sector in the formulation of the blueprint. We want to establish a concrete framework to promote the overall development of the Chinese medicine sector and to integrate into our country's development. And one of the major duties of the Commissioner is to exchange experiences with our counterparts in the GBA. One major topic is how we can collaborate on the formulation of standards and promotion of the industry development in our entry requirements. If they have network in the GBA and in Hong Kong, that would be an advantage. I would like to stress that Hong Kong is a very special place with an integration of Chinese and Western medicine. We want to retain this special characteristic. When we liaise with our mainland counterparts, they are concerned about whether or not we can retain this advantage.
Mr. Tony Che, Madam Chair, as a Chinese, I think that Chinese medicine development over the past period of time in Hong Kong, well, we're not attaching enough importance to the development of Chinese medicine. In 2018, the Chinese Medicine Unit was established, and we saw improvements in various fronts in terms of Chinese medicine development. Members of the public wish to receive Chinese medicine services. In terms of professional qualifications of Chinese medicine practitioners, training of professionals, and promotion of such services, I think need to be enhanced. I give my support to the creation of this commissioner post. Paragraph 4 of the government's paper set out the major duties to be taken forward by the proposed commissioner. As mentioned by the permanent secretary, well, if I understand what he said correctly, I believe within half a year's time, the relevant initiatives will be taken forward, including the formulation of the blueprint. Well, the proposed commissioner post is a D2 post. Part of his or her duties is to deepen Hong Kong's collaboration in Chinese medicine with the mainland and the Greater Bay Area. There are views that an officer at D2 level is not at a high enough level to communicate with the relevant parties in the mainland. Well, would that deter or hinder the post holder to take forward his or her tasks? Of course, the candidate will have to first fulfill all the entry requirements first. Well, there may be such candidates available. However, are you not aggressive enough to look for someone to fill a D2 post or propose to create a D2 post? Thank you. Permanent Secretary. We took into account the fact that the previous head of the Chinese medicine unit was also a D2 level post. So we are proposing the creation of this D2 level post. And we propose to hold external recruitment exercise to look for a non-civil servants to fill the vacancy. Well, early on, when Secretary visited the mainland, he visited the Chinese Medicine Bureau in the mainland, and the topic of the formulation of blueprint for Chinese medicine development was touched upon during the visit, and the relevant parties in the mainland told us that if necessary they could send experts here to offer help. And another Chinese mainland authorities in relation to Chinese medicine also have discussed with us on standardizing Chinese medicine. We have some common goals to work towards, and we also signed a memorandum of understanding in this area. We believe that we won't face a lot of problems in the area of communicating with the mainland parties. Any more questions from members? If not, I'll put this item to vote. Members in favor of the proposal set out in EC bracket 2022-2322, please raise your hands. Well, I see that all of you have raised your hands. I now announce that the item is endorsed. Now the question of whether recommendation for further discussion of the item by the Finance Committee should be made. Members, please note that according to paragraph 2 of the Establishment Subcommittee procedure, members of this subcommittee have to recommend whether paper EC bracket 2022-2322 should be further discussed by the Finance Committee. In accordance with paragraph 40A of the Establishment Subcommittee procedure, I now put to vote the following question. That is, the Establishment Subcommittee recommends further discussion of the proposal it endorsed in EC bracket 2022-2322 by the Finance Committee. I'd like to remind members that if the question is endorsed, it means the subcommittee recommends this further discussion of this paper by the Finance Committee. If it is voted against, that means the subcommittee does not recommend further discussion of this paper by the Finance Committee. Members in favor, please raise your hands. No one. Members voting against of this item or question, please raise your hands. Alright, that means the subcommittee does not recommend further discussion of this item by the Finance Committee. When will be the next meeting? 8:30 a.m. on the 3rd of May. Meeting adjourned. Thank you.